Andrew,
Yo,
how's it going?
I'm pretty good.
Good. Okay, so we are live. I've posted it in the Reddit group. Today we are discussing the role of movement in the. So we're discussing the role of PT, physio, exercise physiologists, and their role in managing persistent low back pain. So I think oftentimes people have really high expectations, or expectations at the beginning of a session need to be addressed very quickly. And so I think at the outset, if people don't have experience with PT or don't know that they can go to physical therapy for persistent back pain as quickly as they could, versus like waiting around, we are going to today set maybe the record straight, or our opinion of kind of that role. So, um, what are your first thoughts on kind of just in general? What's the role of kind of movement providers or exercise for persistent pain?
I think our biggest role would be just to get people back to doing the things that they want to do or the things that they enjoy doing. That kind of just, yeah, summarizes it really quickly, but I think that has so much meaning and depth to it as well.
Yeah, and I think that's kind of the point of today's discussion, is just trying to elaborate. Everyone just says, and probably the most frustrating thing when it comes to treatment for back pain, or people's experiences, one thing works for one person and then not the next. So you have what comes to mind immediately for some people might be chiropractic care, and then you'll have a string of people who say don't do that, or it worked for me and it's the only thing that worked for me. So I think describing for people maybe an expectation, having very defined points can be helpful. So that's what we're going to do today.
Yep.
So what are some of the stereotypical expectations of what not only PTs, physios, but if somebody has back pain and they're going to go to a movement provider or somebody who is a movement professional and treat their musculoskeletal condition like back pain, what's that first expectation?
Yeah, I feel like you see it everywhere on the internet, and like when people comment on stuff and everything, it's like generally it's like, oh, they might give you like a few core exercises or something, and that's like core exercise will make you better, or if you do this one key thing, it'll change your life and your back pain will go away forever. I think that's like a really big thing. Or some people might also think about like passive therapies. It's like, oh, okay, uh, chiros need to adjust me because my body doesn't function the way it's meant to. And
Hmm.
therefore, this person will fix me. And that's what I'll be expecting, things to be done to me from somebody else or something else. Might be medication. It's like, oh, you can be given pain medication, for example, by your GP or whatever as well.
Yeah. So into uh, a relationship with somebody who's going to do something to you, whether it's like even like physical. So it's I'm going to lay down on the table or stand or walk. They're going to do an assessment. The assessment should be something that should explain a lot about my current condition. And oftentimes, because back pain is pretty non-specific, meaning most of the conditions don't have a one singular, very identifiable cause, or something that is in that 1% of scary cases. So sometimes it's walking away without a diagnosis can be frustrating, but that's a side tangent. But what you're describing is somebody's coming in, they're saying, okay, I'm going to lay on the table, they're going to massage me. And oftentimes, I think providers do that, and that's okay. I think we can get into a little bit about how um, other providers feel about massage or hands-on and the literature and all that. But as you and I have both described, I think it has a time and place. But at some point, you should be moving on to some of these other things that I think we'll discuss today.
Yeah.
Another expectation that is like a stereotypical one. Did you already mention like that you should be completely pain free? I know you said that.
Yeah. Not just yet. Yeah.
Yeah. So, if you're one of these people that have persistent back pain and you're getting out of bed as soon as your feet hit the floor, the demand of just regular life and activity is already overwhelming. There's a really good chance that when you start PT, you're probably going to have flare ups, or right from the start, some things might be a little bit too much. And at some point, you should progress to a point where the demand of rehab is greater than the demand of life, but it's like hard to get there. And in that progression, you're likely going to have pain, which is, as long as it's tolerable, is expected.
Yeah, I think it's both tolerable and the understanding that you will be safe or you feel safe during these movements. And that's a whole nother topic as well there.
Yeah, feeling of safety is often challenged by just pain in general, which is kind of like that rabbit hole of discussing pain that you and I are trying to avoid at the moment. But in session, if you can tolerate a certain amount of discomfort and that provider is giving you a framework to use, then you can be rest assured that if you don't have any of the uh, symptoms that would cause like concern for emergency, or those red flags that we often talk about, then it's likely, if it's a tolerable discomfort, it's probably safe. And that's for the movement provider to help you sort of decide
Hmm.
to get
Yeah.
together. I
Yeah,
think
it's like what, yeah, your professional should probably talk to you about what things should we be looking out for. It's like, oh, if you see any of these things, okay, you should probably let me know and we might want to get it investigated further. But if it's not any of these things and it's just pain that feels like just localized just in one area and it just there's ebbs and flows throughout the day, it's like, okay, probably that's going to be expected for the next little while. And just know it's like you will be safe throughout this period, even when there are ups and there are downs. Depending on like whatever activity you're doing, you'll be okay.
yeah. So if you have a provider or movement professional who is only providing certain things like massage and you're not getting better, what would you sort of suspect there in that particular case? That's kind of like a loaded question, but kind of complicated. Um, but yeah, what, like, if the expectation is I want massage and you're almost always getting massage or you're some type of manual therapy and it's been weeks on end, what's what's missing?
It's like, to in my eyes, it's like I think one of the missing pieces of this giant puzzle. It's like, do we have like a pathway back to reconnecting with our life that we were living before? It's like, yeah, I think that's a big puzzle piece that people want to get back to doing. It's like, I'm missing my life, man. How can we get back there compared to just only focusing on feeling better right here, right now?
So you're saying that if you are getting out of bed and you are walking, if you are sitting down to a chair, if you are going to work, then those demands are greater than maybe laying on the table.
Hmm.
That's not
Wait,
your question. So
wait, what do you mean by that? Sorry.
so what you're just saying is that trying to get somebody back to meaningful activities, and if the demand of life, right, is greater than your rehab, how is rehab going to get you there? So that's what you were just describing.
Yeah,
Yeah.
it's like, yeah, in my head, I think that the human body is like really amazing and can adapt and can change like on a day-to-day basis and like second per second basis as well. It's like the body is always changing, right? So if we're able to, I guess, practice or be exposed to certain things that we want to do and need to do in life, that is one piece of this giant puzzle that can get back us to living life again.
So earlier we were discussing before we went live the 6 themes of physical rehabilitation.
Hmm.
And I think if you're somebody who's going through rehab and you're not sure if it's working, maybe you haven't given it long enough because you're one of these people, not it's not your fault, but having the stereotypical expectation that it's going to be better in just a few visits and that I'm going to go to the clinic and be there for 60 minutes and walk away feeling, like the problem's been solved. Looking at these 6 themes, maybe ask yourself, is this something my movement professional that I'm working with is providing? And so the 6 themes, which I will give credit to Ben Cormack on Instagram, and he helped articulate these 6 themes. And I realized, oh, these are things that I personally do. I know Andrew does, but right out the gate, physical therapists, physios, exercise physiologists, people who are working with people in pain should be at the very beginning trying to minimize someone's fear. They should be promoting movement. So if you're stuck on that table, like we were talking about, there should be some form of movement that's meaningful to you. They should be emphasizing your overall health, not just focusing on the structure, like the actual facet joint or the disc bulge or what's happening kind of locally or very specifically. So emphasizing health on stress, coping mechanisms for that, sleep hygiene, so making sure you're getting high quality sleep, and other health emphases would be like making sure that you're are having meaningful activities, having relationships, things like that, which can be hard to discuss in a 60-minute time period, but they should be mentioned. The other thing is dealing with misinformation. So as we talked about at the beginning, chiropractic care, uh, not as a whole, is always uh, something that we are constantly dealing with. There are many great providers out there. It's the narratives that come with them. So if you're kind of like, well, that doesn't really sound logical when you're hearing certain explanations, a movement provider should be saying, hey, this is misinformation and you should be reassured that actually that's not true, or it is. And then improving mindset. So overall, just having a more positive outlook, which I'm been accused of having, when I explain the associations between having attitudes and beliefs about your current condition and how they might influence your pain, people will say that's toxic positivity. And I'm like, it's not, we're not saying just like put a smile on your face and go to work. It's that, hey, recognize that changing your mindset can have an improvement. And then lastly, and I'm going on a tangent here, but these are the 6 themes, that one that likely requires the most individualization is establishing guidelines for what's an acceptable level of discomfort. Because if you, and Andrew, you can talk about this, but what happens if you stop every time you feel discomfort?
Well, I feel like you're potentially signaling to the body that any sign of discomfort should be completely avoided, and then you might become a little bit more hyper vigilant or extremely sensitive just to like the slightest discomfort or sensation that you feel, and then it kind of just becomes like a negative loop, and you're slowly not being able to do what you wanted to do, and you start doing less and less and less because the sensitivity comes on earlier and earlier and earlier on like the thing that you're trying to do. So for example, if you're trying to bend your back just a little bit, then you might you might feel it slightly, and then you slowly can't bend your back at all just because you're like, oh, I'm starting to feel some sensations and I'm starting to feel worried that I'm gonna hurt myself more, and then that all kind of comes back into like the fear cycle there that we like mentioned before. It's like, how do we minimize the fear in people that we see?
Yeah, we have a hard time offering advice for specific questions on Reddit because we don't quite know what people have tried, what people are tolerating. We haven't done an assessment. We're not really able to accurately give good information. And I don't obviously want to offer medical advice to people. So in general, I have a framework that I give people in general that I've shared. Do you, Andrew, have like a framework that is just an example you could give working with somebody to know what's like an acceptable level of pain?
I know a lot of people like to use like a number scale between 1 to 10, I think I like a different method, and it's kind of like a quote unquote traffic light system.
Hmm.
And it's a little bit more complex though, just because you kind of have to learn where your different levels of tolerances are as you explore doing new things or
Hmm.
getting used to doing old movements again. Yeah. So
I use the traffic light system as well. I would say if the number system that people are familiar with, I always say 3 out of 10 is tolerable. So if you have a discomfort with a squat or kneeling or bending over, and it's like a baseline amount of tolerable discomfort, it's probably around a 3. 5 is that Goldilocks, that's moderate, it's not too much, not too little. And 7 and above is like take your breath away, severe pain. So I know
mm,
sometimes when I ask patients the number scale, those are like the North Stars I give them. It's like 3, 5, and 7 is kind of like, okay, now I have a little bit more of a tangible something to like hold on to in terms of making a determination of what's how it hurts in terms
yeah,
of severity. And then I don't know if your traffic light system is like mine, but it's basically like green light is around that 3, yellow light is between 5 and 7, which is like a cautionary approach to a rising discomfort, but still tolerable, sort of. And then anything 7 and above is like take your breath away, is like a red light. So if there's something, and then for a lot of people, this is what's hard is just rolling out of bed. It's like it takes their breath away. And
yeah. I think for me, there's a little bit more nuance to it.
mhm,
So it's like when you're in the green zone or the green light, it's like, oh, these are movements that you might feel like very little sensitivity or no sensitivity or sensations to. And it doesn't really flare you up the next day if you're like not doing much at all or not doing too many of these movements.
mhm,
And then yellow light, it's like, oh, I'm a little bit scared of this movement because this movement has like really aggravated me for days onwards before. Um, and then the red light zone would be like, okay, if I do this movement, like I just had, for example, red light would be I'm gonna be jumping straight into the deep end after resting for five days because
mhm,
it really hurt really bad. And it's like, okay, I'm gonna just go shopping and I'm gonna start lifting really heavy again, just because that's the life that I was living before. And then that instantly flares them up, either during or even the day afterwards as well. It's like I wake up the next morning and it's even worse than yesterday.
mhm,
So I think the red light area, it's like more so something that's guaranteed or has a very high likelihood of like giving you a flare up, while the yellow light zone might be like, hey, I feel somewhat sensitive and I'm unsure how tomorrow will go, but I'll use this as like a learning experience to see how much I can slash can't do right now. And sometimes you can push into like the higher or closer to red zone, and other times you want to people like to stay closer to the green zone since it's not really like these three separate sections. It's like a spectrum.
mhm.
Yeah.
Yeah, that's a good distinction to have. I also like to add the sort of other element of if you do have a rise in discomfort, but it comes back down to baseline in like a 24-48 hour period, that seems to be okay as well.
Yeah, that's like a yellow light that just goes back to green levels.
Mhm.
Yeah.
Yeah, I panic sometimes. For me personally, when my like ankle kind of flares up, and I remind myself of the same framework. And if it, tendons are a little bit different. I think the time frame is like 72 hours. Sometimes if you've got like a really
Yeah, it
bad
can be.
tendon flare up situation, but it's interesting. I think the pain, it guides people so much, and if you treat it like as like a light switch where it's like 0 or 100%, where it's like binary, where it's like if there's pain, it's can't move, can't do anything. um it's hard to navigate life, and so having that framework is actually, it's really powerful when people start to get it and they start to try different things, and it's a learning process. You're not
Yeah.
just going to go, oh, like, because every movement might have a different response. We have varying intensities and varying volume. And to, like, Andrew brought up a really good example of like, I don't know, I'm referring to you in the third person. You brought up a really good I'm talking you brought up a really good point of taking time off, pain comes down. deconditioning kind of takes place, and then you are turning around trying to go back to what you were doing.
Back to 100%. Yeah.
Yeah, yeah, that can be why people have these like bouts of flare ups, and it's like, well, my back's not getting better, and it's like, well, we're not really leaning into the right kind of direction or stimulus.
Yeah, we might be doing too much too soon for what your body can handle right now. And that can change on like a day-to-day basis.
Nice.
So yeah.
Well, so I guess to encapsulate expectations also is not every movement provider is the same mindset. We've all got different biases. Some people are not going to touch up on really any of these themes that I mentioned about emphasizing health or improving mindset, or those things might happen secondary, like as just a byproduct of working with somebody. But if for me, in conversation and coaching and educating, I'm trying to steer people, and like I don't think about these actively like, oh, I'm checking the box, but it's the way somebody tells stories, the way somebody is sharing their narratives. They should be emphasizing these themes.
Yeah.
So
It's less of a checklist and more so things which we explore as we work together over a period of time. It's like just getting to know someone, right? It's like, what do you do in your day-to-day life? What does health look like to you? What does health mean to you? And that definition can be very different between person to person. Just like the same, I guess, definition of how people define fitness. What does it mean to be fit?
mhm.
It has like a million meanings, and everybody's different as well. So I think health is in a similar bucket. It doesn't just have one definition that a textbook can give you. There's a bunch of other meanings as well that everyone can describe through their story.
Yeah. I think where that individualization comes in, it's really hard to, um, as people have experienced it, it's really hard to have a singular
There's no
method
silver bullet.
that
Yeah.
works for everyone. Unfortunately, I wish there was.
Yeah, I wish
Um,
there was. It'd make my life 100 times easier.
like, yeah, it really would.
If I could do
But
stalk, yeah, if core stability worked for everyone, then it's like that'd be super simple, right? But it doesn't work like that. I can't just say this is the one thing that needs to be done. It's like,
mm,
oh, yes and no. There's yeah, it's so situational and individual.
Andrew, as far as I can tell, we have one viewer, so I would not be going down the core stability rabbit hole misinformation just yet. We want to keep him around a little longer. Um, but yeah, since I, for a second I was like, oh, we have two viewers, but I actually have it open over here for the chat. So if somebody is watching like through YouTube and has a question, you can ask, and we can try to work through some stuff. Obviously, we can't give recommendations on medications or surgeries or anything like that. But in general, like if somebody says, I've tried XYZ, and, we're probably going to give you very general recommendations. But the core stability myth, I don't know how much longer you want to do the live for, maybe 5 more minutes, but um, why don't all weak people have back pain, Andrew? And what is weakness?
I feel like this question is such a rabbit or such a can of worms there because it's like, do we have definitions for like all these things? Like, what is stability?
So, like
Like,
at the an example I often am reminded of when people are talking about pain and they're talking about weakness. It's when I was working in the ICU, which was a very short stint. I should just say, it was when I was a student. We worked in the ICU, a very small regional hospital, and then uh, on the weekends, I worked at a hospital after I graduated. So it was like one day a week I was working in people, with people who are very ill. But after a motor vehicle accident, physical therapists, once people are stable, like medically, we get them moving very quickly. And so if we are exposing somebody who's just had a recent trauma through a motor vehicle accident, we're getting them out of bed and we're mobilizing them. there's a really good chance that you can tolerate a lot more activity, yourself. And I don't, mean to make people kind of feel bad, but just more objectively consider and logically think about, okay, is my trunk really actually weak? If we are, when I think of true weakness, I think about the person who needs help sitting up from bed.
Yeah, like a baby, like they just instantly roll over, right?
My favorite thing is when people say kids shouldn't do resistance training. I'm like, a baby is doing resistance training
Yeah, with
24
their body
7.
weight. Yeah,
Yeah.
like when they're learning to sit, you can see them like wobble, and it's like so cute. They're like trying
Yeah.
to just focus on sitting upright.
I used to think
So
babies were so ugly. And then my brother started having kids, and I'm like, oh, those actually do kind of look cute. But yeah, so true weakness, obviously depends on the task, but also if you're somebody who can get up out of bed, even though you have pain, the pain isn't a it's not a derivative or a cause from like trunk
weakness.
weakness. Yeah.
Yeah. Like there are people who, let's say, this might be a bad example, but let's say for a person who's like suffering from anorexia or something, right? There's like not really any muscle on this person, so you might instantly go, "Oh, this person would probably be really weak,"
Hmm.
but they might not have any pain at all. So it's just
Yeah,
like, is there a correlation to weakness and a person who's like very heavily under muscled?
we don't
It's
really
like,
see that.
yeah. So it's
Not to
like if
mention,
you're
like,
at a normal weight, then
yeah,
probably you're not weak. I don't think that's the the one reason why you're having all this pain. It's like there might be way more factors going on under the hood.
I think the difficult thing is associating pain with injury. So I could sit here and say, well, we have strong people who have back pain, and then somebody might say, well, their back is injured,
Mm,
and I get that, but we see and another rabbit hole, another can of worms we always kind of talk about is just seeing normal changes on a spine, imaging and things like that, and so you can have even some of the more gnarly uh, traumatic injuries, and when they're stable, there's no guarantee that I'll actually have pain even then, which is hard to grasp if you're not kind of familiar with the.
yeah, I think probably a better example would be like a baby, right? They probably don't have any strength at all. They're learning to get stronger. Do you think the baby's in pain because it can't do anything yet?
Mhm.
Yeah, but
the
I
the
think this whole conversation is like so weird to think about though, because there's always going to be another one more reason why this person feels this way or why I have pain because of weakness.
Yeah, so the perception of your back not being able to tolerate certain things can feel like weakness, right? So we've got this perception that just we don't sit up maybe quite as quickly. We, maybe when we walk, we're feeling a limp. So when you have pain, there is inhibition to the area, and actually, even unbeknownst to you, the area will stiffen up to sort of protect as well. So you have if you just think about what I'm feeling and the perceptions that come with having persistent pain, they can sort of not trick you, but they can lead you to feeling a sound. I'm just like talking in circles, but they can lead you to believe that you're feeling something that might actually lead you to have make logical conclusions, but might not actually be the case. I guess is what I'm trying to say. Which is
Yeah,
complex. It's just complex. That's how.
yeah. Pain itself is super complex because we have to experience it in the
Hmm.
first place. It's not something that can just happen out of nowhere. Like if we're asleep, we don't feel pain, or if we're knocked out, we don't feel pain. It's like we have to have an understanding of what pain is in the first place for it to happen to us, I guess. It's kind of weird to explain it that way,
Not
but
enough time.
hopefully people, yeah, can understand that. Yeah.
Yeah. So if you just look at kind of like the definition of pain, right, from the International Association of Scientists, Science of Pain, IASP definition is there is an emotional experience that is not only a response to a real threat of tissue damage, but also a perceived tissue damage. So that's where persistent pain comes in. So just going down the rabbit hole of acute pain versus persistent pain, you can have a very appropriate response to acute trauma. But even then, once you're kind of not in that context anymore, you can have a lots. You can almost like, I don't know if you've ever like you can stub your toe, nothing's broken. It can be high amounts of pain. You could do a little paper cut, and there's a little bit of tissue damage, but then after a while, right, there's less pain. It's not a great example. I think the example I do like to give people is there did a study that looked at people. You had like your fingers. You had a group of people where you would have somebody else apply a certain amount of pressure that they measured to a fingernail,
Yeah.
and if a stranger was squeezing your fingernail, your pain response was a lot sooner to less pressure than if you did it to your
To
own.
yourself. Yeah.
Yeah, yeah. So that gets into like contextual factors and things like that. But
Yeah. Yeah. I think probably another example might be headaches and stuff. We don't have like these pain nerves or whatever on our brain because when people get brain surgery, they do it when they're awake and conscious. So that can be an example as well. It's like, how can we still have a headache if physically surgeons can open up the skull to do conscious or yeah, just conscious surgery while you're wide awake the whole time.
that's why I'm not a brain surgeon.
Yeah, so it's
I,
like from like hopefully from all these examples, people can slowly shift to the perspective that hey, pain might not only be tissue damage, there might be more to this. And that's the job of like our profession or like other professionals, like teaching people to understand what are these other factors that we need to touch on. Why are we in so much pain? If it's not, if our scans are quote unquote normal or clear, it's like why do we still feel pain?
the direction I was about to go was kind of kind of considering like people's severity of pain in conjunction to like you're describing tissue damage, and the human body's really strong and natural ability to heal. So if we look at fractures, for example, as long as you know, as long as the bone is set, you can have a fully recovered. It might not be as strong as it was before, but in 3 4 months, like the bone can heal. And why is it that we have lingering pain? And that, I think, is an answer that nobody fully can grasp, but we have really good strong theories for. And so I think having a strong understanding of where and why someone might be having pain triggers. And I think I actually, if I back up, like sometimes when trying to answer Reddit questions, the diagnosis I just sort of am not always super like glued to. And that's just because, coming back to the topic of this conversation, is having expectations with working with somebody is, there's activity modifications. So finding things that you can sort of work around in order to feel better, but also just treating what's present. Like if somebody, you might have a bulging disc and hinging motions bother you, but like squatting doesn't. You don't need to know the diagnosis for that. It's like, hey, we try things. You get a little, you get a good stimulus, a good exercise. So we're, working on that theme of emphasizing your overall health. And um, we're not just trying to take a diagnosis and be like, here's the plan. It's a kind of like a Rubik's Cube or a puzzle.
Yeah.
So any other thoughts, Andrew? I know you're thinking.
Hmm. I think I was like I had like three thoughts, and then when you were speaking, I was like listening to you, and they all just drifted away.
I know it's not easy. Plus, I could go on these like tangents sometimes, so I apologize. We're at 36 minutes. If you want to, I think we did a pretty good job of setting what it's like to work with a provider who specializes in movement, what somebody should be expecting when they going into the clinic. It's not all just things that are done to me, but there's going to be participation on your end. It's probably not going to be within a few sessions, and hopefully you are improving your mindset. You're focusing on other things, not just the structure, and you have a solid framework for determining what's an appropriate level of discomfort, because it's not going to be totally pain free.
Yeah. Yeah, I think to quickly go over like the points that you mentioned before,
Mm-hmm.
it's like minimizing fear can be done with a professional in probably like two big ways. One of the ways is like talking to you and like understanding or helping you understand if this is an emergency situation or not. And if it's not, then we should know that even though it's really painful right now, it's like we're not constantly re-causing or creating more and more damage just because it constantly hurts or it's hurting very frequently from a variety of movements. Yeah, and then moving on to like the next thing, it's like, okay, if we know that we have the green light to move because we're not causing extra damage, it's like, okay, let's practice movements and see which movements cause aggravations and which movements are okay, and like just figure out things in that world, and then the professional might change the way you do things in the short term for aggravating movements, and then slowly they can move on to like a more broad picture thing. It's like, okay, let's talk to you about what health looks like to you and what important things that you want to get back to doing, as well as do you have a lot of fear and worries or concerns that you still have from any information that you might have that you've read online or whatnot. And then slowly you and the professional can just get back to doing what you really want to do. It's just like re-engaging with life, man.
I
Playing
think
for
I
kids or whatnot. Go ahead.
Yeah, and I had a thought while you were talking. Not that I wasn't listening, but I wanted to get this out. Is This is my frustration sometimes with not cookie cutter approaches, because I think you can have general back pain routines with guidance. And when I think about the McGill Big Three, it's not that these movements are not the perfect fix, because for some people they are very helpful. But if you don't have somebody who can help guide you when you're thinking everyone's recommending these three movements, I go to do them and I'm in an immense amount of pain, it didn't work for me. Well, it's like, okay, there are progressions and regressions for those things too. So that's, I think, where the silver bullet kind of comes in. I don't think McGill is saying that these are the three. I think that's just what the community at large has done. Um, so that's a whole nother conversation. But I just wanted to get out. It's like that is a often blanket recommendation, because it has helped a lot of people, and I don't think there's anything wrong with that.
Yeah, they're fine. It's
But
all movements are type of movements that people can practice if they want to, right? It's like if
yeah,
learning to do a curl up or sit back up because it hurts is painful when you do a full range of motion one, then maybe we can practice like a small little one at first. And like the McGill can have that as like a tiny progression or whatever. So it's like it's so individualized. It's like if this thing is important for you to do, then maybe we have tools and methods that we can explore with you to see if they fit the way you want to do things.
cool. I think that was a good summary. It probably would have made it a lot shorter live if we had just opened with that and ended with that. I mean, we were pretty succinct at the end there. But this was a live session that we plan to do weekly, and I think we've decided around the between 8 and 9 hour right now on Mondays for Eastern time in the morning. So if you have questions and want to come and get a live response, we are Stabbed in the Back podcast. We are also looking for people who have overcome back pain, who could share their story to give other people hope who might be in similar situations. So if you've overcome back pain, reach out to us and let us know. We'd happy to hear and share your story. And then lastly, I'm just going to plug Stabbed in the Back podcast as the official podcast for the back pain subreddit, because I think, you will never hear us try to promote any services or any products. So this is really meant to be a podcast that shares stories to give people hope. So until next week,